rebrand can be tricky. Changing your corporate name, identity, and messaging takes skill and finesse. With me on my conversation today is Robin Milne, the Chief Marketing Officer of SnapCare. A fellow Phoenician and Phoenix Suns fan, listen in as Robin shares her journey and that of her companies as the need and demand for clinical staffing is an ongoing condition in the industry. Well, Robin, welcome to What's My Tagline?
Thank you. I'm excited to be here.
Yes, I'm excited too. I actually don't get the opportunity to have conversations very often with people who actually live in my hometown. So the fact that you're actually within driving distance of me, we probably should have done this in a Starbucks or something.
Absolutely. We'll have a follow-up. We'll do it that way.
Oh, there you go. A Starbucks or a glass of wine or something. We can have a follow-up conversation and digest how we did today.
I would love it.
Yeah, that sounds great. So I'm excited about today's conversation, not just because you're in the hood here, but also because the stuff that you're going to be talking about, so some basically some critical conversations. But before we begin, I know that you were warned ahead of time that my first question of all my guests is, if you had to describe yourself as a tagline, what would it be?
It was fun to think about it. And I came up with "It matters to me." And
Oh,
and I would say that's how people view me, is that if I take something on, I do care deeply about it. And it's like, oh, that doesn't matter. And it's like, you know what? Well, it matters to me. I want to make sure we do this right. We bring our best to the situation. So that's my tagline. It matters
ah,
to me.
I like it. I like it. And I have a feeling that that is perhaps a cultural mindset too, a little bit I know about SnapCare as well.
Absolutely. Yes,
Yeah.
yes. This was a really great rebrand exercise for me in particular. So yes, care just, absolutely came to the forefront in our rebrand.
Yeah, it matters to me. I wish the whole healthcare industry felt that way. So, but we'll get into that. But uh, before we sort of get into the meat of the conversation, which is to talk about your rebrand and what SnapCare does and the important role you play in our industry, tell our audience a little bit about yourself. Give us a Cliff Note version of Robin and how you ended up at SnapCare.
I'm happy to. Yes, I've been in the industry a long time, but I've always been sales and marketing oriented. And I did graduate from Arizona State University, so we're still in the
Oh,
hood here
me
with the
too.
right. Go Sun Devils, fear the
Woohoo.
fourth. And I got a marketing and advertising degree, although my career was largely sales, professional sales. So I started in healthcare. I was recruited in college to go work for American Hospital Supply, which doesn't exist anymore, but it took me to California, and I had a lot of my professional career there. I made the jump in healthcare into technology healthcare. I worked for a company called HBO and Company, which is not the TV.
Not the
It's
TV.
Huff Barrington and Owens.
Not
They were one of the
not bad
first.
HBO.
Yeah, not that HBO. Yeah, I had to explain that a lot, in my sales calls. But it was exciting because, it was a company that first figured out how technology could really make things go more efficiently in a healthcare setting. And so it was admission systems and, various, like lines of business within the hospital. So I did that, and then I jumped over to tech. So my big career was with Oracle Corporation, and I actually left California and came to Arizona to open the office for Oracle. And so I spent a lot of time in tech. And then we had our family, and I had the privilege of being home for about 10 years, and got very involved in the nonprofit world in Arizona. Uh, Went back to work as the executive director of Phoenix Suns Charities. So
Oh,
I love
wow.
basketball, love the sport. Our son is a great player and actually works for the NBA. So we're a basketball family. And that was really a great experience for me to do that. I definitely thought I was going to retire after my 5 years at the Phoenix Suns. But then I got pulled back into the business world when a private equity company, and it's actually the same private equity company that really funded what was Snap Nurse, to the next level. They had a project in Park City, Utah, and I went up there. It's a luxury second home community called Promontory Club, and I worked there as the general manager. So I did something really different in my career, and I ran a community. I was, everyone called me the mayor, so Mayor Milne. Came back to Arizona thinking I was going to retire again, and the same private equity asked if I would step in and really build a marketing organization within what was SnapNurse. And one of the big assignments was we are, changing the way that we are addressing the workforce challenges in the marketplace. And we need a bigger name than SnapNurse. We're bigger than that. So Robin, your first job is to rebrand our company. So that's how I started in healthcare, and I guess I'm going to end in healthcare with a few stops along the way.
So SnapCare. So you've gone through this rebrand from SnapNurse to SnapCare, tagline, more tech, right touch. Tell me a little bit about SnapCare. What exactly does the company do, and your role in healthcare?
Yes, it's a really critical role, and I would say that it's staffing. It's staffing for clinicians that need to, come in and either work for a long period of time, to fill a gap or take a shift. A lot of the staffing has been travel because the talent base is not local, and they've run out of their options with the nursing shortage locally, and so they bring in travel nurses. It's also, like the full continuum of care. So you have allied professionals like respiratory therapists and radiology techs. You also have higher level caregivers like a nurse practitioner or a locum, a physician that fills a need. And you also have in the industry the ability to, as a staffing company, sort of outsource the whole, contingent workforce part of staffing in a healthcare facility. And so SnapNurse, they started as filling shifts. The company was started by two clinicians that painfully had to, have their cell phone had all the names and phone numbers of the clinicians that they would call to fill their open positions when somebody, called in sick. Or had a vacation. And so they said, gosh, there has to be a better way to do this. This is like painful. Right. So they left their lucrative jobs and started SnapNurse in 2017 to build, if you will, the Uber of staffing, where they let clinicians go onto the platform and put in their credentials and that, what they were willing to do. And then they, had their hospital post shifts that these clinicians could take. So it was lauded as a great, use of technology in the staffing world. And they were going along nicely, tens of millions in revenue and a great story. And then COVID hit. Yeah. And all of a sudden, the whole staffing, notion in healthcare was that they needed rapid deployment of large groups of clinicians to administer vaccinations and to do COVID testing. So the platform performed beautifully because it scaled. It's a cloud-based system, and SnapNurse was able to put the word out. And interestingly, they used social media. They used Facebook ads and Facebook outreach to bring nurses from, wherever they found them on the, in the digital space to these mobile clinics, that needed hundreds of clinicians at a time. It's like FEMA would say, we're setting up a clinic in Southern Florida. And the SnapNurse platform was able to get the word out and mobilize that number of clinicians in a very short period of time. So it was sort of just an interesting accident, a happy accident that this tech platform existed right when it needed to. It was pressed into service, and for 2 years, SnapNurse was the fastest growing company in healthcare, and certainly the fastest growing staffing company. So they went to revenues in excess of $1 billion 2 years in a row, addressing the needs of the pandemic. So the name was perfect then, right? It was you need a nurse in a SNAP. SNAP, denotes the ease of getting that group of clinicians where they needed to be, and it built a culture of fun, if you will, that kind of work where you would bring a group of clinicians to work closely and tightly for, 6 weeks at a time at a clinic. They became good friends, and a nice social media community was built. So that's the beginning of Snap Nurse, and then after the pandemic and all that need and that way of staffing vanished. You went back to the more traditional way of healthcare, looking at how am I going to fill my open positions, and things really slowed down too. Healthcare,
Sure.
has, as and we talked earlier, just the financial burden of trying to start over again post-COVID, and to try to get clinicians and doctors and the healthcare system restarted up has really kind of put things in a slow motion. I would say it's like things are slowly building back up, and so as a company, Snap Nurse realizes like we're going to have to lean back into the tech and finish building out what we started, because the Uber of healthcare staffing is the way to go, and we were on it early, and that's what is needed again, because technology has got to come in and replace the high cost of labor across the whole healthcare spectrum. And so that's why I was asked to come into the company from a messaging standpoint, is that it was really important for Snap Nurse to sort of, go off into the sunset, because we're not doing that anymore. Rapid response, is not what we're doing now in staffing and healthcare. We are trying to help our healthcare clients optimize their workforce. And it starts with the cost savings to them, starts with them getting a better use of their internal resources. Clinicians used to have to just take the shifts that the hospital gave them as a permanent employee on their staff. And if somebody called out sick, they made them stay, right? No, you're working a double because I don't have anybody to replace them. So the healthcare system did really abuse, if you will, those hours of the clinician willing to work full time. And a lot of clinicians after COVID said, I can kind of take control of my own career now. I can decide when I want to work. And so the notion of a contingent worker, actually, and the Nurse Corps decided that was a better work-life balance for them to, say, yes, I'll take that work. This is good for me now, or my children are in school, and so day shifts are good for me, and I can take those, but I can't work these nights, and I can't stay if somebody doesn't show up. So all of a sudden, the whole notion of workforce is optimizing that mix of who do I have that is on staff. And now a staffing agency isn't, as long as they're not going to gouge me with pricing, and I can't afford travel nurses anymore. Those are the most expensive ones I have. But if I have this tech platform where I can get full visibility into the available talent that I need for staffing, and I can communicate with the groups that I need to come in and fill my shifts, that's the answer. And so we turned our attention into building out our tech to give that, it's now the SnapCare platform, to give healthcare facilities full visibility into available talent, not only their internal staff, but who's local that could fill shifts. And if I can't do everything I need with that group, then I have one more ring out, which is if I need a travel nurse, I have visibility into travel nurses as well. So that's what's new about SnapCare, is that we're bigger than just nurse corps. We are really looking at the talent set across the continuum of care, and being a strategic and trusted partner to our healthcare facilities. So instead of being that bad guy staffing company that was way too expensive for them, we're coming in and saying, there's a right mix here that makes it just right. And the nurse corps will come back in to the healthcare arena if they have a little bit more control over their work-life balance. And that's where the care comes in to play. Care for the clinicians that are doing the work so that they can take care of the patients and deliver the best patient care.
Sure, sure. I mean, obviously, we crossed a Rubicon with COVID,
Mm-hmm.
right?
Yep.
And certainly, the critical shortages that went on and continue to go on post post the crisis of COVID for nurses and clinicians and staffing in general. It's a great book by Dr. David Nash called "How COVID Crashed the System," and he talks about in this book really the impact on the care teams, that are, responsible for taking care of patients, whether remote, whether it's inpatient, ambulatory, or, remote patient monitoring, home care. There was a decided shift, I think, what you're speaking to, this mindset of the workers, healthcare workers here in the U.S. healthcare system. And certainly if I were in healthcare and I saw that I had friends who were in other industries and they were like, oh yes, I'm working remotely and I get more time, but or now I've got a hybrid system where I'm coming in and working somewhat virtually, or I have more control over, as you alluded to, how to structure my work life to suit my needs. And certainly that obviously has spilled over into healthcare.
100%. And I think the other thing that you mentioned that was in Mr. Nash's book is that the delivery system has been forever altered as well.
Yeah, yeah.
And we're seeing retail establishments delivering healthcare at these levels of the full continuum of care. Says sometimes I just need somebody to just really check that it's the flu and not COVID, or a cold, or some like an easy rash to take care of or whatever. So that can be in a retail establishment, or vaccines for shingles or whatever. So the fact that healthcare is starting to figure out that they can distribute what they do and do it well in a number of different arenas, and home health is really
Yes.
moving. Yeah, and a lot of it's just demographics, right? It's where we're going as a population. So having that visibility and you'll see healthcare, groups are looking at, okay, I'm going to have my acute care, and that's the most expensive care that I give, and I'm going to have them in the hospital. But while they're ambulatory and recovering, I can go to the next layer out where I don't need quite the same level of specialty for the clinicians that are working with that patient. And then it goes to the next level out, which is, okay, you're outpatient and you're coming in and we're checking in on you. And then, into the home, making sure you're good. And then, hey, you can go to the pharmacy and get your next round of shots or whatever it is. So the delivery system is changing. And so as a staffing organization, we are very much have our finger on the pulse of that. And we know that technology is going to be a major player of matching where that patient needs to receive care and where the clinician needs to be residing in order to deliver that care.
Yeah, it's such a symbiotic relationship too. Obviously, with the baby boomer generation, we're entering its peak care, basically, right?
Mm-hmm.
And COVID in a way helped that particular generation and those who are older understand that all your care needs didn't start with a phone call to your primary physician or your
Right.
specialist, right? That your pharmacist at Walgreens and CVS, yes, they can give you the shingle shot. They can give you the vaccine. There's urgent care. There's all these different levels of care availability and accessible through technology, right? And so there is this shift, I think, brought on by COVID, but certainly brought on by the pressing needs of taking care of a generation, right? A very large generation who are coming into that part of their life where their healthcare needs are going to be a little bit more demanding, right? And
Yeah.
so to have this marriage of let's get the people who are most critical related to the critical care of your needs in place so that we're not impacted so much, I think is what you're saying, by the shortages that everybody is talking about, right? The burnout, the shortages in clinicians and in healthcare workers, but rather let's utilize the entire ecosystem to get your care that is appropriate to what that care level is.
Yes, and absolutely. And here's one of the main tenets too of our platform, and that is the digital credential of that specialty clinician and or allied, again, whoever needs to deliver the care that you need. Sometimes it's behavioral health, et
Sure.
cetera. So, right, all those are healthcare professionals that need to be matched to the need. And so to have a platform where it's easy to upload your credentials and be, certified, if you will, for the specialty that, you want to work in is critical. And so we have a very comprehensive joint commission accredited credentialing part of our platform. And that also gives us insight and data. We currently have about 370,000 clinicians in our
Wow.
database across the country.
Wow.
Yeah, and it gives us insight into who we have, but also, when we're talking to our clients, we understand the gaps, right? The gap analysis. And so for us, we're trying to also, be a part of the solution to the nursing shortage. And a lot of that is helping the clinician core reskill or upskill to a need. And so we have programs in place through we have the newly formed SnapCare Foundation. Super excited about it. We are funding it internally and with partners right now, and its purpose is to provide education and reskilling and upskilling opportunities for our clinician core so that they can plug into maybe a higher paying job or into a setting that isn't something that they were trained for, but they enjoy. So one of our big contracts right now is to supply school nurses in the state of Florida. And there are lots of clinicians that thought that would be really easy to do, but it turns out that being a school nurse is kind of a tricky thing because
It
there's
is a
a lot of
tricky thing.
yeah, there's a lot of soft services there, dealing with parent groups and
Sure.
those crafty kids who find their way into the nurse's office. So we have, we're ideating a program to help, credential them or move them into a setting that is lucrative and a kind of a nice long-term job that appeals to a certain type of clinician. So I'm excited about providing opportunities for our clinicians through our company, and it is our social responsibility and our give back initiative that we have as a company, and we're really excited about what's going to happen there.
This is an initiative in 2024.
Exactly. We have the foundation initiated, and so we're getting it funded, and so we are looking forward to some of our first scholarships in early 2024.
Yeah, yeah. So I'm going to harken back to your tagline. It matters to me. When I read stories or I listen to podcast episodes that are nurses telling their stories, and you know, some of them sadly are why they left healthcare. Um, this idea of creating using a platform to create a culture where they can give the kind of care that they would like to give, that maybe this is a situation maybe they didn't enjoy inpatient, maybe they didn't enjoy working in the ER, maybe they didn't enjoy working in primary care, but there are paths for that clinician to explore other avenues and find the care setting that is best for them.
Absolutely. No, and I think it's also our tagline under the SnapCare name, which is more tech, right touch.
Mm.
So the tech allows that better or right touch, not only for the career aspirations of the clinicians, but that the relationship that we as a company establish with our healthcare provider lets them be a better employer. And so that care, part of it and that right touch part of it is a really big part of the two sides of the platform.
So, Robin, what else do you have as we wind down here? What else do you got rolling out in 2024? The foundation sounds very exciting.
Yes, well, and I think the other thing that we're excited about is that we really do want to thank and reward our clinicians that have worked steadfastly, with us through the COVID and now. And so
Yeah.
we're establishing a SnapCare rewards program. And so I think that's going to, add to that digital community, online, social community that we have, where we're going to give out snaps, when something really, great happens, or we get a clinician that goes above and beyond, or, continues to extend, on their deployment to help the hospital out, So I think our rewards program is going to be really well received, and we're excited to do it with our clinicians.
That is a great idea. Sort of that analogy that used to, Uber, basically, this clinician's getting a 5-star rating here. So let's acknowledge that.
Exactly. Exactly.
Yeah, well, that's exciting. Robin, I've so enjoyed our conversation today.
Same. And thank you. And it's nice that you knew so much about the industry. And so we're all, participants in one way or another with healthcare. But I really encourage, your listeners to lean in, more to how, healthcare needs to, evolve to better serve our needs.
Yeah, yeah. Oh, yeah. I mean, it's that old saying, healthcare is complicated. Healthcare is complicated, but healthcare can get better.
Oh, yes, and it is getting better. And I think, and that would be the number one thing to say, is that the nursing shortage is getting solved
Yeah,
because, we're meeting those nurses where they are and where their needs are. And I think that even different, payers situations and schedules are going to start recognizing the contribution of nurses in particular to the continuum of care.
yeah, yeah. That's great. Have a successful 2024, and I expect that we will get together and talking about the Suns.
Done deal. Thank you,
Yeah.
Carol. Really enjoyed it. Thank you.
You can learn more about Robin by checking out her LinkedIn profile or visiting snapcare.com. Learn more about this show by visiting the program page on healthcanowradio.com and follow me on Twitter at Carol Flagg or on LinkedIn. Until next time, I want to know, what's your tagline?